Hello. On behalf of San Joaquin County, thank you. Thank you for your commitment to your job and the work you do to achieve county goals. I would like to personally thank you for taking time today to participate in training on how each of us can help slow the spread of coronavirus, commonly known as COVID-19. Upon completion of this training, if you have any questions regarding the material covered, please contact your department COVID contact. A few caveats before we begin. All of the information being provided today is based on Cal OSHA, Center for Disease Control, California Department of Public Health, and local health situation with COVID-19 as of October 2021. Therefore, you should continue to keep up with the most current guidance from each authority on how to maintain workplace safety. Healthcare workers and emergency responders may have additional and/or different guidelines that must be followed. Coronavirus disease, commonly referred to as COVID-19, presented to you by Risk Management, revised November 2021. Our objective here today, we will discuss and review Cal OSHA's Emergency Temporary Standard. What is COVID-19? Exposure to the virus, hazards associated with exposure, prevention, the difference between isolation and or quarantine. The ETS requires that employers provide and ensure employees wear face coverings when required and when occupying a vehicle with other people for work purposes. Provide and ensure employees wear face coverings when required and when occupying a vehicle with other people for work purposes. Provide and ensure employees use respirators and other personal protective equipment, PPE, for exposure to people with suspected or confirmed COVID-19 and for aerosol generating procedures on a person with suspected or confirmed COVID-19, and provide respirators and other PPE in accordance with standard and transmission-based precautions. As part of the county's commitment to protect workers and deliver stronger work safety protections, protocols and practices were established to protect workers from exposure to COVID-19 in all settings. We worked very closely with other employees to come up with this plan. The ETS requires that employers conduct a hazard assessment and implement a COVID plan for each workplace. Designate workplace COVID contact who will implement, monitor, and ensure compliance with the program. Every department has a COVID contact. Limit and monitor points of entry to settings where direct patient care is provided. That may include screen and triage patients, clients, residents, delivery people, and other visitors and non-employees entering the settings for symptoms of COVID-19, and implement patient management strategies. The standard requires that we develop and implement policies and procedures to adhere to standard transmission-based precautions in accordance with Center for Disease Control Guidelines, CDC. What is COVID-19? Coronavirus, COVID-19, is a new virus that causes respiratory illness in humans. It is originated in China. Coronaviruses are a large family of viruses that are common in animals such as camels, cattle, cats, and bats. They are zoonotic, which means they normally exist in animals, but can infect humans. And then we start to see transmission from person to person, same as seen with SARS and MERS. Coronavirus cases, about 80% of them are not severe. Approximately 20% of coronavirus cases are severe and can cause pneumonia, respiratory failure, and the need for ICU care and possibly result in death. Symptoms may appear 2 to 14 days after exposure to the virus. Let's talk about exposure. Exposure is defined as having close contact within 6 feet of COVID-19 cases for 15 minutes or greater, cumulative within a 24-hour period. The time frame for having contact with an individual includes the period of time 48 hours before the individual became symptomatic. How is coronavirus spread? Mainly spread by droplets that come from the nose or mouth of an infected person when they cough or sneeze or speak. These droplets carry tiny pieces of viruses that can infect another person when they breathe in or touch their eyes, nose, or mouth. The virus can only infect someone if it comes into contact with their mouth, nose, or eyes. Keep your hands out of your face. You just want to do that. People can transfer the virus to their mouth, their nose, and yes, if they touch surfaces where droplets have landed. So keep your hands clean and keep them out of your face. An infected person can spread the virus before they show symptoms. We refer to that time frame as pre-symptomatic, or without ever showing symptoms, referred to as asymptomatic. Less commonly, the virus spreads over longer distances when smaller droplets or particles linger in the air, particularly in indoor settings with inadequate ventilation. Another less common way the virus can spread is when someone touches a contaminated surface and then touches their nose, mouth, and eyes. I keep stressing that. It's very important that you keep your hands out of your face and practice good hand washing hygiene. What are some of the signs or symptoms of COVID? And understand that some of these symptoms can mirror other conditions. So unless you can account for another reason for you having these symptoms, it may be COVID related. These symptoms can include fever or chills, new loss of taste or smell, cough, sore throat, shortness of breath or difficulty breathing, congestion or runny nose, fatigue, nausea or vomiting, muscle or body aches, diarrhea, headache. If you are sick, notify your employer and stay at home and isolate yourself from others. Contact your local healthcare provider and get tested if you have symptoms of COVID-19. Call 911 if you're experiencing trouble breathing or pain, pressure in your chest. The website for CDC to get more information on symptoms testing and what to do if you're sick will be shared with you at the end of this presentation. When to seek medical care. Seek emergency medical care immediately by calling 911 if you or someone is having trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, pale, gray, or blue-colored skin, lips, or nail beds, depending on your skin tone. These are not all possible symptoms. Call your medical provider for any other symptoms that are severe or concerning to you. The ETS requires that within our COVID plan, we have policies and procedures that include, but are not limited to, screening, including self-screening, personal protective equipment, face coverings and respirators, N95s, aerosol generating procedures on a person with suspected or confirmed COVID-19, physical distancing, physical barriers, cleaning and disinfection, ventilation, vaccination, training, telework, flexible scheduling and alternate work schedules, video or telephone conferences, modify, postpone, or cancel mass gatherings. There is a hierarchy of controls for slowing down the spread of COVID-19. The most effective control is elimination, vaccinations, or physically removing the hazard. Substitution, replace the hazard. Engineering controls including isolating people from the hazard. Administrative controls, changing the way people work. The least effective is personal protective equipment. How to prevent COVID-19? Well, we're encouraging you all to wear face coverings that cover your mouth and nose. Avoid close contact with others and stay at least 6 feet apart from other people. Avoid crowds and poorly ventilated spaces. Wash hands often with soap and water for about 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Clean and disinfect frequently touched surface daily. We're going to talk more about cleaning and disinfecting as we go along. Get a COVID-19 vaccination, and we're going to talk about that a little bit more as well. You need to understand this about the COVID-19 vaccine. It takes 2 weeks for the body to build immunity after vaccination. You are not considered fully vaccinated until it has been 2 weeks after your final vaccination. During that time, it's important that you continue to self-screen, cover your cough, stay home if you're ill, clean surfaces. Respirators and other PPE. Departments provide personal protective equipment in accordance with standards and transmission-based precautions in healthcare settings, in accordance with CDC's guidelines for isolation precautions, and ensure that protective clothing and equipment is used in accordance with Cal-OSHA aerosol transmittable disease standard. Can be found in California Code of Regulations, Title 8, Section 5199. For employees with exposure to people with suspected or confirmed COVID-19, departments will provide a face covering in accordance with the Emergency Temporary Standard, subsection 3205. COVID-19 vaccination is a safer way to help build protection. Getting the virus that causes COVID-19 may offer some natural protection, known as immunity. However, experts don't know how long this protection lasts and understand that the risk of severe illness and or death from COVID-19 far outweighs any benefits of natural immunity. COVID-19 vaccinations will help to protect you. I know it is easy to be confused by all the information that is circulating, some of which may be conflicting. CDC has facts to counteract common myths, such as COVID-19 vaccines will not give you COVID-19. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. Getting vaccinated can help prevent getting sick with COVID-19. COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. But note, while COVID-19 vaccination will not cause a positive result on a viral test, there is a possibility that it could cause a positive result on a serologic antibiotic test. Let's discuss guidelines for fully vaccinated employees who do not work in a healthcare or high-risk congregate setting. Under Cal-OSHA's ETS, it exempts fully vaccinated employees from the requirements of personal protective equipment, physical distancing, and physical barriers in well-defined areas where there is no reasonable expectation that any person with suspected or confirmed COVID-19 will be present. Employers must verify employee vaccination status and document verification. Unvaccinated or employees refusing to provide status must wear masks in indoor settings, physical distancing, and physical barriers as required. Employees in healthcare or high-risk congregate settings must follow California Department of Health order. That order requires that the employer demonstrate proof of full vaccination by utilizing either COVID-19 vaccination record card or photo of a vaccination record card or photo of client's vaccination record card or vaccination record card stored on a phone or electronic device or vaccination documentation from a healthcare provider or digital record that includes QR code or documentation from other contracted employer. Employees who do not vaccinate will be required to test at least once per week. Employees who work where care is provided are required to test twice a week and wear appropriate personal protective equipment. There are two exceptions to vaccination. Number one, the worker is declining vaccination based on sincerely held religious beliefs, or two, the worker is excused from receiving any COVID-19 vaccine due to a qualifying medical reason. At this time, please pay close attention to the demonstrations for properly donning, doffing, face covering, and respirators, N95s.
Sam's patient has an upper respiratory infection. Sam knows what to do. Sam puts on a mask and enters the room. Sam? Sam performs hand hygiene. Sam secures her mask either with ties or by placing elastic ear loops around her ears. She fits the flexible band to her nose bridge, making sure it is snug to her face and below her chin. Sam knows her front of her mask is contaminated. Sam performs hand hygiene. Instead of touching the mask, she grasps the ties or elastics of the mask, carefully removing the mask without touching the front. Sam discards the mask in the waste container. Sam performs hand hygiene. Great job, Sam.
If your employer provides respirators for your voluntary use, or if you provide your own respirator, you need to take certain precautions to make sure that you use the respirator correctly. Respirators are an effective method of protection against respiratory hazards, but only when properly selected, worn, and kept clean. Facial hair can cause leakage, which can let contaminants get inside the respirator. This is also true for any other objects such as jewelry and hats that might interfere with a face piece to face seal or straps. Only use respirators approved by the National Institute for Occupational Safety and Health, NIOSH. Use respirators certified to protect against the contaminant of concern. A label or statement of the certification on the respirator or respirator packaging will tell you what the respirator is designed for and how much it will protect you. Do not wear your respirator into atmospheres containing contaminants that the respirator is not designed to protect against. Always follow manufacturer instructions on use, maintenance, cleaning, and care, and warnings regarding the respirator's limitations. Keep track of your respirator so that you do not mistakenly use someone else's respirator. This could be done by storing it in a marked container or bag. A disposable filtering facepiece respirator, also known as an N95 mask, helps protect against many types of airborne particles, but not gases or vapors. To get the most protection from an N95, you need to understand three things. 1. How to put it on. 2. How to make sure it is properly positioned on your face. And 3. How to remove it. The following are general instructions on how to put an N95 respirator on. Make sure it is seated on your face properly, and how to remove it. Make sure you follow the manufacturer's specific instructions. Using one hand, place the respirator on your face with the nose piece at your fingertips, allowing the straps to hang freely. The nose piece should span and cover the bridge of your nose. The respirator should cup your chin. Pull the top strap over your head, resting it high on the back of your head. Pull the bottom strap over your head and position it around your neck and below your ears. Do not crisscross the straps. Make sure your mouth and nose are covered by the respirator if it has a metal nose piece or strip. Use both hands to mold it to the shape of your nose. Each time you put on the respirator, you want to make sure it is properly positioned on your face. This is done by conducting a seal check. The idea is to make sure that air is not leaking between your face and the seal of the respirator. To conduct a positive pressure seal check, cover the surface of the respirator with your hands so air is prevented from passing through the filtering facepiece. Gently exhale to see if the facepiece bulges slightly. To conduct a negative pressure seal check, take a quick deep breath to see if the facepiece collapses slightly. If you feel air blowing through the seal on your face or eyes during either of the seal checks, then the respirator may not fit your face properly. Readjust the fit and check the seal again. To remove the respirator, cup it in your hand to maintain its position on your face. Pull the bottom strap over your head while holding the respirator in position. Pull the top strap over your head and remove the respirator. Store the respirator away from contaminated areas. Before using the respirator again, inspect it for damaged or missing parts. If parts are damaged or missing, dispose of the respirator and use a new one. If the N95 is visibly contaminated or your breathing is restricted, dispose of it and request a new one. For additional information on the requirements for voluntary use of respirators, please review Appendix D that provides information for employees using respirators when not required. Also, for employees in regions affected by wildfire smoke, please review the Cal OSHA standard on voluntary use of respirators and the training requirements found in Appendix B of Title 8, Section 5141.1. Additional information and resources on COVID-19 prevention and N95 respirators for voluntary use can be found in Cal OSHA's COVID-19 Frequently Asked Questions at www.dir.ca.gov/COVID-19 FAQs. Cal OSHA also has a consultation service to provide technical assistance to California employers.
Let's keep talking about prevention. It's important that we all do our part to help slow the spread of COVID-19. We can do this by doing self-monitoring for COVID-19 symptoms. Remember, stay home if you're sick. Ideally, you should take your temperature twice a day. A temperature of 100.4 degrees is a reason for concern in contacting your medical care provider and not coming to work. Coughing, difficulty breathing, shortness of breath, sore throat, chills, headache, muscle or body aches, loss of taste or smell. Understand that we are in flu season. Some people do have allergies, and these symptoms mirror one another. So unless you can account for why you have these symptoms, consider COVID. Seek evaluation from your medical provider. When do I self-release from isolation for COVID-19? If you are sick and know you have COVID-19, stay home in isolation away from others for at least 10 days. On day 10, Ask yourself 2 questions. 1, for the past 24 hours, I have had no fever. And 2, my other symptoms have improved. If you answer true to both of these statements, you may self-release on day 11. If not true, then stay in isolation until true. If you tested positive for COVID-19 but never had any symptoms, stay home in isolation away from others for 10 days. On day 11, you may self-release from isolation. Environmental cleaning. The main difference between sanitizers and disinfectants is that sanitizers reduce the number of germs on surface, whereas disinfectant kills most of them. Sanitizers usually work faster than disinfectants, which can take up to 10 minutes to kill germs. The name hand sanitizer is a misnomer, since its main germ-fighting ingredient is alcohol, which is a disinfectant. It's important that we clean and disinfect frequently, particularly high-touched items, tables, doorknobs, light switches, countertops, handles, desks, phone, keyboards, in your homes, your toilets, faucets, sinks, etc., in everyday use and pandemic measures. Individuals working in healthcare settings are to refer to the CDC and state health department guidelines for protection of healthcare workers. In the current and past coronavirus outbreaks, healthcare workers have had a high rate of infection. It is especially important to ensure that procedures, equipment, and training are fully protective. The CDC site includes guidelines for infection control, emergency medical services, home care, long-term care, clinical care, evaluating persons under investigation, and more. Now let's discuss outbreaks. There are 2 types of outbreaks. The first one we're going to talk about is referred to as multiple outbreak. It is defined as 3 COVID-19 cases within an exposed group within a 14-day period. The 3 cases are only among employees in that group. However, this may include contractors, subcontractors, or employees of other businesses or agencies. Affected employee testing must be made available weekly, with the exception employees not present during the relevant 14-day period, or employees fully vaccinated who do not have COVID-19 symptoms, or recent COVID-19 cases that have returned to work and do not have symptoms. For returned COVID-19 cases, last for 90 days after the employee's original onset of symptoms, or if the recovered COVID-19 case never developed symptoms 90 days following the first positive test. All employees in the exposed group, regardless of vaccination status, must wear face coverings when indoors or when outdoors and less than 6 feet from another person unless an exception applies. Employees have a right to request a respirator for voluntary use, an N95. The second type of outbreak is referred to as major outbreak. Major outbreak is defined as 20 or more COVID-19 cases in an exposed workplace over a 30-day period. When a major outbreak occurs, an employer must provide testing twice per week, exclude all COVID-19 cases, investigate workplace illnesses, and take steps to eliminate any COVID-19 hazards. Provide a respiratory for voluntary use. Report major outbreaks to the local health department within 48 hours. This reporting requirement is also for employees covered by Assembly Bill 685. Employers must comply with the major outbreak requirements under the ETS standards until no new COVID-19 cases are detected in the workplace for a 14-day period. The COVID-19 vaccine is as essential as you are. Add one more layer of protection to keep you and your family safe. Again, remember, Employees are the most important asset of the county. Let's do everything we can to slow the spread of COVID-19 and protect ourselves. What's next? Managers and supervisors, be advised that there is an addendum to this presentation that you are responsible for completing. It reviews managers, supervisors' responsibilities for COVID-19. I thank you all for your time today. Let's all do our part to stay safe, to remain healthy, keep our families safe and healthy. Get your vaccination. Thank you.